Hello everyone. Today's training is to learn more about workplace injury prevention for Redwood staff and employees. There are 8 main agenda items. What is an incident? Accident case studies. Accident case flowchart. Types of accidents by department. Causes of incidents. Accident prevention. Cost of incidents. Safe work culture. What is an incident? An incident is any unplanned or unwanted event. It can cause injury or illness to an individual, property damage, a near-miss event, or a combination of these effects. Types of workplace accidents. The following are examples of accidents commonly reported by employees at Redwood. Eye and skin irritation, open wounds, swollen feet due to being struck by heavy objects, finger injuries, contact with a table saw blade, contact with a knife or cutter, contact with the sharp corner of an object, puncture from a drill bit. Ergonomic injuries, improper lifting technique, body and lower back pain, slipped disc, difficulty walking normally. If an employee complains of fever, stomach pain, fainting, or is involved in a motorcycle accident, please report the incident to the Human Resources (HR) department. This chart shows accidents for the year 2025 by injury category. This data helps identify key risks and preventive measures to ensure a safer workplace. This slide shows an accident chart by department. This data allows us to identify departments with higher risks and plan appropriate and effective preventive measures to improve the safety of all employees. There are 5 types of incidents. First, near-miss events, with no injury or damage. Second, unsafe behavior or unsafe conditions that could lead to an accident. Third, property damage, including damage to equipment, materials, or the environment. Fourth, minor injuries or first aid cases with sick leave of fewer than 4 days. Fifth, serious injuries or fatalities, which must be reported to DOSH, with sick leave exceeding 4 days. There are 5 types of incidents. First, near-miss events, with no injury or damage. Second, unsafe behavior or unsafe conditions that could lead to an accident. Third, property damage, including damage to equipment, materials, or the environment. Fourth, minor injuries or first aid cases with sick leave of fewer than 4 days. Fifth, serious injuries or fatalities, which must be reported to DOSH, with sick leave exceeding 4 days. In this case, a worker nearly fell from scaffolding, but 3 workers below managed to prevent the scaffolding from toppling. The incident had the potential to cause serious or minor injury and property damage. Preventive measures include ensuring scaffolding is inspected before use, wearing safety harnesses, training on safe work procedures when working at heights, and controlling the surrounding work area. Case study of unsafe behavior and unsafe conditions at Redwood Furniture. Examples of unsafe behavior include workers not wearing face masks and nose covers, face shields during welding work, and safety helmets when working at heights. Additionally, common unsafe conditions observed at Redwood Furniture include fire prevention equipment being frequently obstructed and safety guards being left open. Preventive measures include enforcing the use of appropriate PPE for each task, ensuring safety equipment is always easily accessible, closing guards, and conducting regular safety training. A property damage case study shows a fire incident that occurred at the work premises. The incident had the potential to cause serious or minor injuries, property damage, and compensation claims. Preventive measures include maintaining electrical equipment, keeping flammable materials away from ignition sources, inspecting fire suppression systems, and conducting fire safety training for employees. A property damage case study shows a fire hose reel damaged after being struck by objects. The incident could cause property damage and compensation claims. Preventive measures include ensuring pathways and safety equipment are not obstructed, placing warning signs, and training employees to take care of safety equipment. A minor injury case study covers 6 cases. The first case involved a cut wound on the right palm. The second case involved a laceration at the base of the left little finger and a minor abrasion on the back of the left hand near the base of the finger. Preventive measures include the use of gloves, ensuring the work area is safe, and training on proper work procedures. The third case involved a puncture wound on the right ring finger, while the fourth case involved irritation to the left eye. Preventive measures include the use of gloves and safety glasses, along with training on safe work procedures. The fifth case involved a cut wound on the left middle finger, while the sixth case involved a laceration on the left palm. Preventive measures include the use of safety gloves, maintaining safe hand positioning, and safe work procedure training. A serious injury case study covers 6 cases. The first case involved an eye injury, while the second involved a fracture at the tip of the left index finger. Preventive measures include the use of safety glasses and safety gloves, training, and compliance with safe work procedures. The third case involved a laceration on the left finger, while the fourth involved nail trauma or subungual hematoma. Preventive measures include the use of safety gloves, awareness regarding the prohibition of machine misuse, safety training on proper heavy load lifting techniques, and provision of a first aid kit. The fifth case involved a cut wound on the left hand. Applicable preventive measures include the use of anti-cut safety gloves, the use of tool aids to hold small workpieces, and safe work procedure training. The sixth case involved a soft tissue injury in the lower abdominal area. The preventive technique to be practiced is to seek assistance from a colleague when lifting loads exceeding half of one's body weight, and to ensure the work area is safe before any lifting is carried out. First aid treatment. First aid is the immediate care given to a person who has been injured or suddenly taken ill. It is administered before professional medical assistance, such as an ambulance or doctor, arrives at the scene. There are 3 main objectives of first aid. In occupational safety, first aid aims to preserve life by carrying out basic emergency procedures to ensure the victim survives, for example, CPR. Prevent further injury by ensuring the victim's condition does not worsen, for example, by stopping bleeding. Promote recovery by providing comfort and initial treatment to help begin the healing process. The causes of incidents can be divided into 3 main factors. First, human factors such as unsafe behavior, negligence or lack of focus, fatigue, personal problems, and insufficient training or understanding of safe work procedures. Second, unsafe workplace conditions, including inadequate lighting, a cramped or disorganized work area, number 5S, slippery floor surfaces, and faulty equipment. Third, management factors such as inadequate supervision, incomplete safety training, inconsistent PPE enforcement, insufficient risk assessment, and lack of maintenance. Understanding these causes can help us prevent future incidents. The primary cause of incidents stems from human factors such as loss of focus, fatigue, or personal stress. When workers are not fully focused on the task at hand, the risk of errors increases. Lack of awareness of hazards and a careless attitude toward safety procedures also contribute to accidents. Incidents can also arise from workers not complying with safe work procedures, for example, placing hands too close to a rotating machine part during a cutting process, or not using aids such as a push stick when cutting small pieces of wood, leaving hands in the danger zone. These actions increase the risk of direct contact with saw blades and result in injury. Incidents can also arise from workers not complying with safe work procedures. Workers place their hands too close to the rotating part of the machine during the cutting process. Furthermore, workers do not use aids such as a push stick when cutting small-sized wood, causing the hands to be in the danger zone. These actions increase the risk of direct contact with the saw blade and cause injury. Workplace conditions also contribute to incidents. For example, a disorganized work area or one that does not practice 5S can disrupt worker movement and reduce focus during work. Additionally, slippery or uneven surfaces can cause workers to fall and get injured. Insufficient lighting can also cause workers to misjudge safe distances. Machine guards may not be installed or may not be in good condition. An overcrowded or unsafe work environment can also lead to incidents. The 5S principles are a workplace management method aimed at improving efficiency, safety, and cleanliness. The first principle, sort, SISA, means separating and discarding unnecessary items in the workplace, keeping only needed tools and materials, disposing of or relocating unused items. The benefit is reducing clutter and hazard risks. The second, set in order, SUSIN, means arranging necessary items so they are easy to find and use, labeling storage areas and assigning specific locations for each tool. The benefit is saving time and preventing loss of equipment. The third, SHINE, SAPU, means regularly cleaning the workplace, removing dust, wood shavings, oil, and dirt, and inspecting equipment during cleaning. This helps detect early equipment faults and improves safety. The fourth, Standardize, Saragam, means establishing standards to maintain the first three principles, using checklists and cleaning schedules, and applying visual controls such as color coding. This ensures consistency and discipline. The fifth, Sustain, Sentiasa Amal, means continuously maintaining 5S practices through employee training, audits, and encouraging discipline. This builds a culture of continuous improvement. The importance of 5S lies in its ability to improve workplace safety, increase productivity, reduce waste and downtime, improve work quality, and create a systematic work environment. Management or system failure refers to weaknesses in the planning, implementation, monitoring, and improvement of occupational safety and health systems that contribute to incidents. It indicates that the controls the organization should have established are not functioning effectively. First, failure to implement safe work procedures, SWP. Although procedures have been prepared, management fails to ensure they are understood, complied with, and consistently practiced. No periodic reviews or compliance audits are conducted. Second, weak safety enforcement. No disciplinary or corrective action is taken against safety noncompliance, creating a work culture that treats safety rules as unimportant. Third, an unsystematic training system. No structured training plan covering induction training, refresher training, and competency assessments. As a result, workers may perform tasks without a thorough understanding of hazards and risk control measures. Fourth, failure of effective risk assessment, HIRARC. Risk assessments are not updated to reflect changes in work processes or machine usage. Critical hazards such as the risk of contact with rotating machine parts may not be identified, or recommended controls may not be implemented. Fifth, an ineffective maintenance system. No periodic maintenance system or organized maintenance records to ensure machines are in safe condition. Safety components such as machine guards or emergency switches may not be inspected regularly. Additionally, safety communication failures, information about hazards, procedure changes, or control measures is not clearly communicated to workers, leaving them unaware of risks when carrying out tasks. Accident prevention involves several important steps. Training and awareness, such as conducting regular safety training and encouraging reporting of near-miss incidents. Complying with safe work procedures and using appropriate equipment. Maintaining workplace tidiness and cleanliness by ensuring no obstructions in walkways and storing materials safely. Using personal protective equipment such as gloves, safety helmets, safety glasses, safety shoes, ear protection equipment, and safety harnesses when working at heights. And conducting regular inspections and maintenance to identify and prevent hazards early. The cost of incidents refers to the total financial losses, both direct and indirect. Direct costs are those that can be calculated directly as a result of an accident and usually have clear financial records. Examples of direct costs include employee medical treatment costs, employee compensation payments such as SOCSO, hospital and medication costs, paid sick leave, repair of damaged systems, and insurance claims. These costs are easy to identify because they involve actual payments recorded in the company's financial system. Direct costs are usually only a small portion of the overall cost of an accident. Indirect costs refer to hidden costs that are not directly recorded but have a financial impact on the company. Examples include loss of productivity, operational disruptions or downtime, supervisor time spent on investigations, replacement employee training, damage to company reputation, decline in employee morale, delays in product delivery to customers, and loss of contracts or clients. Indirect costs are often higher than direct costs because they involve long-term effects on the company's operations and performance. Although difficult to measure, they have a large impact on company profitability. It is estimated that for every 1 ringgit of direct accident costs, there are between 4 to 11 ringgit of indirect or hidden costs. This shows that the actual cost of an accident is far higher than what is visibly apparent. Even though a company may only see direct costs such as medical bills or employee compensation, there are many hidden costs that have a major impact on the company's operations and finances. Safety culture refers to the values, beliefs, attitudes, and behaviors shared within an organization that determine how safety is managed and prioritized at all levels, from management down to workers. Characteristics of a positive safety culture include management commitment, employees taking responsibility for their own safety and others, open communication about hazards and near-miss incidents, continuous safety training, and a blame-free reporting culture. Workplace examples include workers stopping unsafe work without fear of punishment, reporting and discussing near-miss incidents, supervisors setting an example by using PPE, and safety being prioritized before productivity. Let us all look after our own safety and the safety of others in the workplace. Maintaining safety is a shared responsibility. Thank you for your time.